and welcome to Laranara. And today we have another Q&A session for you. And in this video we answer all of your questions about prostate cancer. And I encourage you to keep your questions coming through social media, Facebook, Twitter, etc. on our YouTube channel in the comments or via email and phone. Contact information is going to be in the box below. We do this periodically and answer your frequently asked questions about all of the subjects that interest you. So without further ado, let's answer your frequently asked questions about prostate cancer. So let's kick this off by answering the question whether the PSA value is relevant for prostate cancer. If you don't know what PSA is, many urologists diagnose prostate cancer by testing your PSA value or performing a biopsy or a digital rectal exam. This PSA is the prostate-specific antigen and is a protein that is produced by normal as well as malignant cells of the prostate. And the PSA test measures this level of the antigen in your blood. The results are usually reported as nanograms of PSA per milliliter of blood, and the liver, the lungs, as well as the woman's breast also produce this protein. The PSA test was originally approved by the FDA in 1986 to monitor the progression of prostate cancer in men who had already been diagnosed with prostate cancer by other methods, and in 1994 the FDA approved the use of the PSA test in conjunction with a digital rectal exam to test men for prostate cancer. Today, the FDA accepts, however, that the PSA test alone is not characteristic for prostate cancer. A number of benign, so not cancerous conditions can also cause a man's PSA level to rise. The most frequent benign prostate conditions that cause an elevation in PSA levels are prostatitis, which is an inflammation of the prostate due to gonorrheal infection, and benign prostatic hyperplasia, which is an enlargement of the prostate's lateral lobes. Some doctors also consider that a PSA value of 8 to 10 is specific for prostate cancer, while others consider that a PSA level of higher than 2.5 only is already a marker for prostate cancer. And all evidences show that any activities that inflame the prostate temporarily, such as a recent excessive sexual activity or biking or other intense sport activities, can actually trigger temporary prostate inflammation, which will translate into an elevated PSA value. In 2012, the US Preventive Services Task Force officially voted against PSA as a test for detecting prostate cancer because it often missed cancers that were there and found cancers where there weren't any. Prostate cancer also, keep in mind that it progresses very slowly normally, and men are more likely to die with it from other causes than from the prostate cancer itself. If a patient is older than 50 and his PSA constantly moves up by 50% or more per year, it's still not biopsy time therefore. Another question that we hear often is prostate biopsy safe? Well, in 2013, the American Society of Clinical Oncology at its annual meeting presented a very provocative paper in which they analyzed the 100-day mortality rates in men who participated in a prostate, lung and colorectal screening trial, and the death rate was only 1.3 per 1,000 biopsies performed on men without cancer, and higher than 3.5 per 100,000 men in those who had cancer. This is consistent with a previous analysis of the European randomized study of screening for prostate cancer, and that study resulted in a net conclusion that the biopsy harms outweigh its benefits. So what are the risks that are associated with a prostate biopsy? Well, bleeding at the biopsy site, rectal bleeding is very common after prostate biopsy actually. Blood in your semen. It's common to notice red or rust coloring in your semen after prostate biopsy. Blood in your semen may persist for a few weeks even after the biopsy. Blood in your urine. Difficulties urinating. The prostate biopsy can cause difficulties urinating after the procedure, and a temporary urinary catheter must be inserted therefore. Also, you might suffer from decreased ejaculation, erection difficulties, or even impotency. Infections can develop from a biopsy. Men may develop an infection of the urinary tract or prostate that requires treatment afterwards. The Associated Press reported, for example, on June the 2nd, 2006, that more than 22,000 veterans who underwent prostate biopsies at the veterans hospitals across the country were being warned that improperly sterilized equipment may have exposed them to deadly viruses. Prostate biopsy is also a real injury which can accelerate inflammations of the prostate tissue. Any biopsy can contribute to a spread of cancerous cells, especially due to a relapse of the psychological stressors and of biological procreation conflict. And a prostate biopsy is an invasive procedure with a high risk for infections, urinary bleeding, and cancer relapse, to sum it all up. So careful with the biopsies. So if the PSA values are not indicative of prostate cancer and the biopsies are not really recommended, what is the best test for finding out if you are suffering from prostate cancer? Well, a correct diagnosis of prostate cancer must go through over different tests. First, blood tests to determine the deficiencies such as vitamin, minerals, and amino acid deficiencies. Then, body toxicity analysis shown in blood, urine, feces, and saliva, which disturb the cell's polarization and the energy flow. Then, body hormone determination, especially testosterone levels, estrogens, and other major hormones. But also a psycho-emotional panel to identify the psycho-emotional conflicts and the sabotage programs. The prostate cancer gene 3, PCA3 test, requires nothing more than a urine test that looks for active genes that are found only in prostate cancer cells, and most insurances will cover this test. It's been available since 2004, but few physicians unfortunately use it. We can trust the PCA3 test because in 95% of the diagnosed prostate cancer cases, the PCA3 gene is highly visible. So way better method than looking at the PSA values. Then the power color Doppler ultrasound exam. It's non-invasive, it's painless, and takes about 30 minutes, and it shows prostate tumors, even the tumor's type, the location, the stage, as well as other abnormalities. If the test results are inconclusive or there's a typically slow-growing cancer, watchful waiting is our recommendation. Another question that comes up frequently is, why do we see more prostate cancer after the age of 50? Well, if a patient is older than 50, his PSA usually moves up by 25 to 50% per year. And why is the PSA increasing after this age? Because consistent with a male's vital role in reproduction, the biological psycho-emotional conflict linked to the prostate gland concerns the procreation, of course. And this function is very sensitive to emotional events in a male's life and affect also his prostate. He is unable now to father children, maybe due to erectile dysfunction or infertility, or a female partner's infertility, or maybe the man has suffered a vasectomy, which is a surgical sterilization, or the male's descendants don't reproduce because of a homosexual orientation, or you stay childless by choice, or miscarriages that happen, or abortions. And this all creates what is called a mating conflict, so you are not able to or allowed to mate, and this translates in turn into sexual rejection and feeling sexually unwanted. Mating conflicts are activated through the loss of a sexual mate or through sexual rivalry, such as the fight over a female, and a man's fear that his sexual mate is attracted to another man could already trigger this type of conflict, especially when the competitor is younger or has more potential, so to speak, than him. Then we have the gender conflict that can be experienced as an ugly conflict with a female. So if you are being dominated, controlled, or humiliated by a woman, an imperious wife, for example, or degraded by female authorities such as a supervisor, a judge, a lawyer, a police officer, and the like, you can go. This conflict can affect directly your prostate. A spiteful divorce, custody battles, emotional financial abuse are also possibilities for conflict scenarios. And the psychosomatic conflict linked to the prostatic ducts and the ejaculatory ducts is the so-called territorial marking conflict. In this case, the marking conflict has a sexual nuance and a distinctive prostate procreation touch. A man can suffer this territorial conflict when, for example, his ex-wife doesn't allow him to see his children anymore, or when his space is invaded by a sexual rival or by a domineering female. The ejaculatory ducts also relate to an ejaculation conflict, as in not being able or not being allowed or not wanting to ejaculate. And with a prolonged conflict duration, secretory growth, referred to as a benign prostate growth, develops as a result of the continuing cell augmentation and conflict. And if the rate of cell division exceeds a certain limit, conventional medicine considers this to be a malign prostate tumor. Another question is about the symptoms that you have to be on the lookout for when it comes to prostate cancer. And there are some distinct symptoms that can indicate that you are suffering from prostate cancer. For example, interrupted urination, urine with blood, and painful urination. There are also more benign reasons why a man finds that his urine does not flow freely and may come with bleeding, and it's painful and wakes you up many times during the night. In the course of the transition from middle age to old age, the prostate gland often becomes enlarged, and a variety of medical conditions can cause so-called nocturia, which is urination during the night. The urinary tract infection or bladder infection might be a symptom. Infection or enlargement of the prostate, prostatic hyperplasia can be an indicator. Bladder prolapse, overactive bladder, tumors of the bladder, prostate, or pelvic area. If you're suffering from diabetes, anxiety, kidney infections and kidney stones, especially sandy stones, edema or swelling of the lower legs can indicate prostate cancer, obstructive sleep apnea, as well as neurological disorders such as MS, Parkinson's, or spinal cord compression. But those are only, of course, indications. It doesn't mean that if you're suffering from one of those symptoms, you necessarily have prostate cancer. Other symptoms to look out for are, for example, constipation and other gastrointestinal issues. In many cases, constipation results from a bad diet rather than from a life-threatening illness such as prostate cancer. So the first step should be to consult with a dietitian and check your gastrointestinal system and not assume that you are suffering from prostate cancer. People who regularly suffer from constipation are more likely to develop prostate gland problems, however, because this condition puts more pressure on your prostate. Pain in the lower back area might be an indicator. A deep and prolonged aching feeling in the area of the lower back that continues for a long time could be a warning sign. People are much more likely to associate pain in the pelvis area with prostate problems, but nobody should perform their own diagnosis as we've recommended. There are a lot of medical tests that you should perform before you come to the conclusion that you suffer from prostate cancer. Difficulties getting an erection. There is, of course, a stigma surrounding erectile dysfunction, and many men therefore do not report it, either as a standalone issue or as a symptom of something that is possibly underlying and yet undiscovered. Men who suffer from prostate cancer often report difficulties in getting and maintaining an erection. And this is a common condition for males who are strongly self-devaluating themselves. And this kind of psycho-emotional conflict is weakening the prostate muscles, and it's very characteristic for men over 50. Painful ejaculation might be another symptom. This symptom ties in with the painful urination, as both the urination and the ejaculation share much of the same hardware, which is the urethra. Many elderly patients report a painful sensation in the groin area when they are about to climax, and this is caused by the inflammation and enlargement of the prostate, which in turn can block and obstruct vital passageways. Experiencing pain when ejaculating does not automatically mean that you suffer from prostate cancer. BPH or prostatitis can also be the causal factor behind this painful ejaculation, as well as a number of sexually transmitted diseases. If the prostate growth is located in the lateral lobes of the prostate, it is usually a benign prostate hyperplasia, and gonorrhea that originates in the prostatic ducts can be diagnosed as prostatitis if the inflammation and discharging symptoms are less severe. Another question is prostate cancer metastasizing in the bones? In the bones, you do not get metastasis from prostate cancer, but you can build up second cancers related to your strong self-devaluation conflict and loss of self-esteem and self-confidence. Thoughts and feelings such as I am not good for anything, I am not a man any longer, no woman wants me, they all weaken the muscles in your body, and many of them are necessary for erection and sexual intercourse. And when your doctor tells you that you got metastases in the bones from a spreading prostate cancer, please bear in mind that the culprit is your self-devaluation. Why is it not possible to have prostate metastases? Well, the prostate adenocarcinoma cells that result during the cellular growth process, well, these cells cannot break out of the tumor and migrate to the bones, where it will have to change its genetic information to create a cancer with cellular loss, as bone cancer is always a cell loss, so you get holes in your bones. A positive PSA test and a subsequent prostate cancer diagnosis lead to radiation treatments or surgery usually, and after radical prostatectomy, so the removal of your prostate, most men are left with urinary and fecal incontinence, living in diapers with erectile dysfunction, which in turn causes self-devaluation conflicts that affect the bones that are closest to the prostate. So that's why you see often prostate cancer as well as bone cancer. Your next diagnosis will be bone cancer of the pubic bone, usually, or lower spine. And next, the lung cancer that corresponds to the death-fright conflict, and this will usually be the end, unfortunately. And these other cancers have nothing to do with a migrating prostate cancer. What is the natural therapy that we propose then? We developed a multiple faceted therapy for prostate cancer. First, of course, you need to get a fair and correct diagnosis. As we've talked already about, many mistakes can be made there already. It is important to know whether you have glandular adenocarcinoma or a prostate ductal cancer, and several tests are necessary, as we have already described. Together with the patient, then we find and resolve the biological conflicts that relate to procreation, mating, and gender, or in case of a prostate ductal cancer, the territorial marking conflict. You can do this by talking with the patients and create the necessary awareness about existing conflict, several emotional release sessions that we perform via Skype help you to find viable solutions to those conflicts, and different relaxation therapies such as yoga or meditations also have shown to have very positive effects. Sometimes the hardness and the size of the prostate tumor changes during these sessions already, and you can feel this during the DRE that is made before and after the session. And then to take care of the prostate infections that are caused mostly by microparasites and other urogenital diseases such as gonorrheal infections and local inflammations, we recommend that you take orally our unique cytostatic natural herb extract called Prostamisin. Prostamisin is actually vivid artemisinin with a big difference that we have infused it also with beneficial frequencies to support this psychosomatic conflict resolution that we've talked about. The therapy takes 42 days or longer depending on your condition, and you get 25 milliliters per bottle that you should take every day for 42 days. And we also recommend a whole list of other specific supplements to support this process. What other natural treatment methods do we recommend besides the unique Prostamisin? Well, galvanic current therapy is a great solution. The galvanic DC currents have a fantastic healing effect in the treatment of cancer of any kind. Galvanic equipment offers prostate patients a safe as well as non-invasive alternative treatment without risks and side effects, without relapses and metastasis, no infection risk, and it outperforms many of the conventional cancer treatments in its efficacy as well. Galvanic devices treat successfully prostate cancer without additional damaging the patient's erectile and sexual functions. They preserve the bladder control intact, so you don't get the urination complications as you do with many conventional treatments, and you don't get in general all the significant drawbacks of conventional treatments, which are a major concern for most patients. How does galvanic therapy heal your prostate cancer and all of the metastases? Well, physics as well as cancer physiology has taught us that all cancer cells have an electrical conductivity that is 10 times higher than this in healthy cells, and therefore the DC current will always preferentially penetrate the cancer cells. Tumor cells are nonpolar and have very low membrane permeability and are therefore difficult to treat with chemo drugs and other remedies. Galvanic therapy therefore enables the ions from the tumor surroundings to enter the cancerous cells much easier. The negative ions accumulate around the positive electrode, which is also called the anode, and generate chloric acid there, which has a pH of only 2, and the positive ions, which are usually metallic ions, go automatically towards the cathode, so the negative pole, and there they generate hydroxyl ions, which are very alkaline. pH of those is around 13. And this very big difference between the pHs of 2 and 13 within the cancerous cells immediately destroys the tumor cells, and they are practically cooked out, meaning they liquefy and necrotize. Prostate cancer treated with galvanic currents normally goes into full remission in about 6 to 12 weeks, and you have no chance of relapses and metastasis as well. How is it applied? Well, the plus electrode is placed on the prepubic zone and the negative pole on the perineum zone, and currents of 0.5 milliamperes to 12 milliamperes are used for a duration of about 3 hours per day. And of course you can get some great galvanic therapy devices for home use as well as professional use, such as the galvanic therapy device that you see here in the picture on the right, exclusively at lyranara.com. And with all that being said, I hope that we were able to answer your most frequently asked questions about prostate cancer. Keep your questions coming on the subjects that interest you. We collect them periodically and try to answer them in a video, as we did now with prostate cancer. If you need personal advice, do not hesitate to contact us, shop at lyranara.com, or call us toll free. The number and the whole contact information is going to be in the description box below. Please also support our work by subscribing, sharing and liking this video if you've enjoyed it. And until next time, stay healthy.